My name is Dr. Andrew Koivuniemi. I'm a neurosurgeon with Franciscan Physician Network, and I'm here to talk with you about lumbar microdiscectomies today. Lumbar microdiscectomies are probably one of my favorite surgery in all of neurosurgery. The reason is it's a very quick and easy procedure. Most patients have minimal pain from their back. They're able to get out of the hospital the same day it is done. And a lot of the time, my patients notice that their pain is significantly better immediately after surgery. A lumbar microdiscectomy is a surgery intended to treat herniated discs in the low back. The disc is a shock-absorbing part of the spine that sits between two large bones of the back. Sometimes the soft nucleus pulposus, the inner core of the disc, can push out and pinch against a nerve in your back. What patients often experience when they have this happen is an extremely irritating pain that shoots from their back and down into their leg. Depending on which nerve is pinched, it will probably go to a different part of your leg. Other times, patients will also notice that they can develop some sort of weakness in their leg, either with their foot or with their knee. If you're experiencing weakness, then typically we want to do this surgery sooner rather than later. If you're experiencing pain, we might try some other interventions in order to relieve that pain without requiring surgery. The good news is, even if you don't get better with those conservative measures, surgery has a very, very high chance of success. 90 to 95% of patients who undergo this surgery are very, very happy that they did so and say that they're satisfied. So what is a lumbar microdiscectomy? The good news is it's a very, very common procedure that does not take us terribly long. After your sleep in the OR, we'll position you face down. We take a very, very small tube, about the size of a quarter, and we put that through a very small incision in your back. Operating through that tube, we can find the disc that's pinching your nerve, we can remove the disc, and then we can relieve the pressure on that. We take the retractor out, we close everything up, and that's pretty much all there is to it. Most of the time, we're able to close the incision with a stitch that dissolves, so you don't have to worry about coming back to see us to have your stitches removed. And then we can see you back usually in about 4 to 6 weeks to make certain that you're doing well. Recovery from a microdiscectomy is very straightforward. The vast majority of these surgeries are outpatient, so you're able to go home the same day that the surgery is done. You might notice that your back is a little bit sore, but that'll get better with time. And I strongly recommend that you try to get up and move. If you're completely lying in bed and you don't move, those muscles in your back can get more tight and more sore. I want you to get up and get around the house, climb stairs, do things like that. The only thing that we typically recommend is to avoid strenuous activity right after these surgeries. I've had a lot of my patients feel so good after the surgery that they start doing a bunch of things that they've neglected. And because they start lifting heavy objects and moving furniture, that can put a little bit too much stress on that disc, and that can cause it to re-herniate. So that's our one little warning to every one of our patients. I would say the majority of my patients don't require physical therapy after this. If my patient is having some difficulty with weakness or their pain isn't getting much better right away, then I'll often send them to a referral for physical therapy. The good news about herniated discs is most of them get better on their own. The other good news is for the ones that don't get better on their own, the surgery to help them is a very, very straightforward procedure, and most patients do extremely well. That's why I like the microdiscectomy so much. If you'd like more information related to this topic or other topics related to the spine, please go to franciscanhealth.org.